Hello everyone, myself Shivangi Manoj Patel. I am from 4th year BBT. Today I will be speaking about an important neurological condition that is called ACA syndrome, which stands for anterior cerebral artery syndrome. The anterior cerebral artery or ACA is one of the major arteries supplying blood to the medial parts of the frontal lobes and superior medial parietal lobes of the brain. When this artery is blocked or damaged due to a stroke or infarction, it leads to a collection of symptoms known as ACA syndromes. Let's talk about the clinical features first. So, one of the most common and characteristic sign is contralateral hemiparesis, which means weakness of the opposite side of the body. However, this weakness is more pronounced in the lower limb than the upper limb. There may be also contralateral sensory loss, especially in the leg. Because the medial frontal lobe is affected, patients can experience apathy, confusion, lack of motivation, and problems with initiating movement, a condition known as akinetic mutism. In some cases, urinary incontinence can also occur due to involvement of the medial frontal micturition center. If the dominant hemisphere is involved, speech disturbances may occur and grasp reflexes might return. Now, coming to the management of the ACA syndrome. Management includes both medical and rehabilitative approaches. In medical management, the acute phase is managed similarly to the other types of stroke. If the stroke is ischemic and within the treatment window, thrombolytic therapy like TPA may be given. Antiplatelet agents, anticoagulants and statins are used to prevent further clot formation. Blood pressure, sugar levels and cholesterol should be controlled to reduce risk factors. Now, moving towards the rehabilitation management, that is PT management, this is where physiotherapy plays a major role. First of all, we will give strengthening exercises are given especially for the lower limbs since weakness is more in the legs. Gait training is essential to improve balance and walking ability. Postural control and coordination exercises are also important to prevent falls. Occupation therapy may be used to improve daily activities and independence. And speech therapy is needed if the patient has difficulty speaking or swallowing. Next is we will give cognitive training and behavior therapy that helps to manage apathy, disinterest or emotional disturbances. Overall, early diagnosis and a multidisciplinary rehabilitation approach can significantly improve the outcomes in ACA syndrome. Conclusion. To conclude, ACA syndrome may not be as common as MCA strokes, but it has a unique features like lower limb weakness and frontal lobe involvement. With proper medical care and focused rehabilitation, patients can regain functional independence and improve their quality of their life. Thank you.